Courtney from Pure Legacy Chiropractic. Today what we're going to talk about is x-rays, why we take them, why we need them, and how they help me help you. So here at Pure Legacy, every single patient that comes in is going to get x-rays. X-rays are extremely important for me to understand exactly how to adjust you and adjust you different than everyone else, right? We're not all made identical, so we shouldn't all be adjusted identical. So these x-rays tell me that. These x-rays help me be extremely specific, because when we're adjusting this little guy, your atlas, we have so many important neurological structures that hang out around him. We have the blood flow to your brain and your spinal cord running straight through here. We have your spinal cord running straight through the middle of here and going out to your entire body, fingertips all the way down to your toes. We have a very important part of your body called your brainstem that sits right here. That brainstem controls what's called our autonomic nervous system. That nervous system is in control of our heart, our digestive system. When we breathe out, breathe in, breathe out. All of that is controlled right there in that brainstem. Really important part of our brain. But lastly, we have what's called the cerebrospinal fluid that covers our entire brain, our spinal cord, but also runs through here. A disruption in this fluid will cause turbidity and issues with our brain healing the way that it should. So we're able to analyze and assess all of those things with the help of these x-rays. So this very first x-ray we're going to talk through is one of the extremely helpful x-rays for understanding where your head is sitting at in space. So when we look at this x-ray, of course, we're always looking for atlas, and he's hanging out right here. And you can see he's kind of outlined with this yellow line in this x-ray. This line helps me understand where he's sitting and what kind of pitch he has. Now, when we look down here at the lower neck, it helps me understand, do we have any degeneration? Do we have any trouble with our discs? Do we have any issues where our head is sitting out in front of our spine? This patient here, she needs to actually bring her head back and get a little bit more curvature in her neck. All of these are things that we're looking for on this x-ray, and it tells us that within this x-ray. This x-ray also helps me understand musculature, though. If your head is sitting out in front of your spine, our head actually weighs the same as a bowling ball, so 8 to 14 pounds. So whenever that 8 to 14 pounds is hanging out in front of our shoulders and it's hanging out forward, now we have all that pressure and tension on those structures that I just talked about, as well as muscles, ligaments, and tendons are all having to take an extra brunt of the labor from your head being out in front of your body. So now the next x-ray that we'll take whenever you come into our office and become a new patient is what we're going to look at now. So this x-ray is going to tell me, there we go, this x-ray is going to tell me which way you've rotated. So right here you see this nice crisscross pattern, and what this crisscross pattern tells me is which way your atlas has rotated. So for this patient, her atlas is actually rotated backwards over here on this left side. So that helps me understand that now we have a disruption in blood flow, in that we can find disruptions as far as the way the blood's getting to our brain, high blood pressure, different changes like that, all naturally caused just because this little guy has moved out of place. So this last image that we'll look at, that we take with every patient as well, is one of the most interesting ones as far as understanding this guy. So what we see, if we remember from the last x-ray, this little guy right here, this is the left side, this is the right side. This little guy over here has come back on this side, but we'll also see whenever we look at this x-rays that it's also come up over on that left side. All of these little tidbits tell me about how I'm going to adjust you, but this x-ray has this neat part, as well as some of the other ones, but this one is one of the ones that really helps me understand the shape of your bones. It gives me a mental 3D picture of your body and how we can adjust you and get you the best adjustment to put this guy back where he belongs. The best way to think about upper cervical chiropractic, and once we see it on these x-rays too, is that what we're doing is we're just taking out what's kind of hindering you from healing and changing and helping, and we're just letting your body do exactly what it was always intended to do and heal exactly the way that it was intended to do. No fancy, crazy drugs or procedures or anything like that. We're just letting your body naturally heal the way that we're supposed to. These x-rays tell me exactly how to help you heal, unlike anyone else. You'll see all these numbers over here. All of these numbers are very specific to you and your healing. So With these numbers, that's actually how we continue on and actually get to the adjustment. Is I'll adjust you off of these numbers and basically undo whatever we've seen on these x-rays and bring you back to neutral and balanced and let you heal and function and relax and go back to being who you were maybe before an accident or an injury, or even just over time, go back and heal some stuff that's happened. So if you have any questions about these x-rays, how your body's functioning, any questions for me at all, please give me a phone call, call our office, come by, and we'll be more than happy to hopefully help you understand what's going on in your body, your neck, and in your x-rays, and get you feeling better.